I think the one word that would summarize all this for me, having sat through this for several days, is insightful.
Invigorating.
Enlightening.
Optimism.
Engagement.
Very informative and fun.
In real life, all the stakeholders in the marketplace, they meet and they negotiate contracts and they had adverse positions. In the simulations, we actually put them together to play a role that's different than the real life role, but they need to work together to solve the healthcare economy pictures, the big picture solutions, which they normally don't get to do in real life.
When we think about really transforming the healthcare economy, it's not one player, it's multiple stakeholders coming together. It's not one group or one particular stakeholder's problem, it's all of our problems to fix. And the only way that it can get fixed and really transformed is by bringing multiple groups together, which is what we're doing.
Very unique situation and environment for us to bring in our provider community, our benefit partners, and our clients into one common central setting and have them have a discussion that removes their barriers of their daily life and get engaged in the healthcare economy.
Quite eye-opening, just realizing all the different players and really the cause and effect to when you change one thing, what happens to another and how that affects other people.
It teaches you how interrelated all the different constituents in healthcare are and helps you understand how the role of government affects the role of the payer and the role of the employer and the role of the provider and how really interrelated they are in solving problems or affecting change. So it is a very simple tool in that way to address a very complicated issue.
People have worked very well together. I think they've done a really nice job of trying to put common issues on the table. I think they've done an exceptional good job of trying to understand each other's viewpoints so that they can work better and more collaboratively as we depart the market.
I think when you get into the simulation and go through the experience and start understanding that there's value in collaboration, there is value in understanding the other parts, I think it gives an invitation for them to reach out to the other stakeholders in the market in real life to talk to them. And a lot of those people are actually at the simulation as well, so you create a network of new people.
I think this might be one of the most exciting steps for helping to create community involvement. One of the things about healthcare is very much like politics, it's all local. And this is a local model. And I think if we could see, for instance, in Oregon or in Milwaukee or in Louisville, if this model could go out and have an impact in those communities one by one, we could start creating a much better health system.
I get an opportunity to talk about a really important problem with a lot of very smart people. So that just right there, just the opportunity to interact with people throughout the healthcare arena, the conversations just allow me to learn a little bit more about what other people think we could do to solve the problems.
We believe that we're just beginning to tap the potential of creating networks of influence that have the potential of changing the way things are.
I really like the computer tool that they've got because you can make decisions about the market. You're looking at a healthcare market, you can make decisions about changes you want to make in that market, and you can immediately see what the impact is. And then to be able to look out 3 years, frankly, in healthcare, that's a lifetime. So that's really been exciting.
What becomes really apparent in the simulation is that as you pull the different levers and as you activate the simulator, the model is built to reflect all of those moving parts, and that you cannot pull one lever without it impacting something else over here.
Thoroughly, there was not one moment where anyone was bored interacting. It shows you that it can be done.
What the model does differently is it allows you to actually try different things to see how if employers did things a little bit differently and providers did things a little bit differently and they tried to partner, what would the impact be and how would the government role change? And it's just a lot of, it's an opportunity to actually try concrete examples and get out of the abstract and more into the specific, which really there's no other opportunity to do that. That's what's neat about it.
Remember here, we're trying here to build a bridge between the decisions you made and the actual results. If you remember from that graph I showed you, how did you execute on your plans?
People really do care, and people really want to make it work, but we're somewhat confined in the systems that we live in, whether it's a legislative system or our work system, that we're trying to find the right solution, something that will benefit everyone, and we're trying to figure out a way to remove those confinements and those constraints to come up with the solution.
One of the things that we acknowledge is the health system is broken right now, and we're not getting the results for the investment that's going in. And so everybody shares a concern about that, how to improve it, how to make it better. Look, it's going to take us all working together to come out with a different outcome. If we keep doing what we've been doing, we're going to get more of the same.
We need to get together, everyone in the community, and try to find ways to collaborate. If everyone kept together and work on it, you can find solutions that work. And most of those solutions are local.
Our goal is to understand what is it that the community wants, and better understanding how we can be a part of the solution to move this into a healthy realm.
It was very enjoyable, challenging, and something I'm going to be thinking about for, quite a while.
I thought it was very exciting, very challenging. I thoroughly enjoyed the speakers between our working sessions. It was an excellent program.
It gave me the opportunity to just broaden my horizons, which was the goal. I was very pleased.
I've been very impressed with the quality of the people, the presenters, and I think the content's been well thought out.
I think we might be beginning to take a step that could actually get us someplace.